Professor Ahmed Okasha is the founder of Okasha Institute of Psychiatry and director of WHO Collaborating Center for Training and Research in Mental Health in Shams University, Cairo, Egypt. He is the chairperson of WPA Ethics and Review Committee for 12 years and a member of the WPA Executive Committee and Secretary of WPA Scientific Section for 6 years. He was the President-elect of WPA from 1999 to 2002 and served 12 years as the regional representative in North Africa and Middle East and was the President of the World Psychiatric Association from 2002 to 2005. He is the current chairperson of WPA Council of Honorary President, the Arab Federation of Psychiatrists, and Egyptian Psychiatric Association. He is on the editorial advisory board of 23 international scientific journals. He is a fellow of the Royal College of Physicians, Edinburgh, and Royal College of Psychiatrists, London, and Presidential Commendation, American Psychiatric Association. He was awarded from the Egyptian Academy of Science the State Prize in Creativity in Medicine in 2000, the State Merit Award in Medical Sciences in 2007, and the highest honor in Egypt, Nile Merit Award in Medical Sciences in 2010. Medal of Science and Arts of the First Degree in 2013. He was awarded the Golden Medal and Honorary Fellowship of IACA-PAP, the International Association for Child and Adolescent Psychiatry and Allied Professions in 2004, and is a member of the Egyptian Presidential Council of Distinguished Scientists. He is an advisor to the Egyptian President to mental health and community integration. Good afternoon, Professor Okasha. On behalf of WPA, I welcome you today to the series Meet the WPA Leaders. Thank you, sir, for giving your time for the interview. And indeed, it is my great honor to be part of this series. Professor, you have served the WPA as the president for 3 years. Please share with us your experiences during this marvelous tenure you had.
Of course, it is a very rich experience regarding comprehensive knowledge of so many psychiatrists all over the world. And again, it is not only 3 years of my presidency. I've been serving for more than 26 years in the WPA. It started as a zonal representative of WPA in North Africa and Middle East, this for 12 years. I served then as a member of the Executive Committee of WPA, again, Secretary of Meetings, Scientific Meetings, for another 6 years. Then I served for President-elect for 3 years. Then I am a president from 2002, 2005, which again, another 3 years. And now, currently, I am the chair of the council committee, the chair of the council committee. The council is the previous presidents of the WPA who are living, of course, and I am the chair of this group of council for 3 years. So as you see, it's about 26 or 27 years of experience. There is no doubt that being president of the WPA gives me a chance to give assistance and help for so many of the developing countries. And this is usually in the program of any president. Being able also, I forgot to tell you that I was chair of the Ethics and Review Committee for 9 years of the WPA, in which I have to have the code of ethics renewed every now and then. So it has been for 9 years, and we'll talk about this later. What I want to say that it's quite a rich experience to be working with the WPA and having friends from all over the world and having acquaintances from all over the world and sharing the scientific activity all over the world.
Thank you, Professor.
There is another point, I'm sorry to interrupt you, that the World Psychiatric Association is a global association representing currently 145 psychiatric societies from 121 countries, bringing together more than 250,000 psychiatrists worldwide. And it is mentioned or stated that actually it is the largest medical association worldwide. Just to get you acquainted about the diversity of the functions of the WPA.
It is remarkable that WPA is the leading body of medical professionals in the world. During your 3 years in office, you had many opportunities and challenges. Those opportunities and challenges which has made us progress. So please share with us some of the specific incidents from your 3 years.
And I just want to mention a bit of these things. First of all, that I initiated in the beginning of my presidency the child mental health program. And this was a very important aspect because actually 20% of children and adolescents under the age of 18 have a diagnosable mental disorder. And I found that there is no at all mental health act for children worldwide. And even the Child and Adolescent Psychiatric Association never managed to have this. So to have somebody from the World Psychiatric Association adopting to have a program, especially that when we realized from the WHO that suicide is the third leading cause of death among adolescents. And also there is a virtually worldwide absence of identifiable child and adolescent mental health policy. So I managed to recruit 72 professors and psychiatrists for children and adolescents from all over the world. Of course, this needs meetings and this needs a budget. And I managed to get from one of the drug companies, and not mentioning at all any of their products, $1 million to cover the 3 years of experience, after which the objectives, which is very important to understand, increasing awareness of health decision makers and health professionals and the general public about the magnitude and severity of problems related to mental disorders in childhood and possibilities of their resolution. Number two, introducing and promoting the implementation of primary prevention of child mental disorders. Number three, providing support to the development of mental health services for children with mental disorders and to the development, adaptation, and the use of effective methods of treatment. And we had 3 task forces, and you have to follow exactly what it should be done. Because the 3 task forces on service development and management. And we can find all the details of the products in the files of the WPA, and because it has been very important, and we produced a book called The Mental Health of Children and Adolescents, an Area of Global Neglect. And this was, I was the only one who is not a child psychiatrist, but I was with the editors in this. And I think this is one of the main things that the International or World Association of Child and Adolescent Psychiatry has offered me the golden medal, and thanks, because it's the first time that something done for, as I told you before, 20 or 30% of the children of the whole world. The second thing, which is very, again, very important, that we had something in the ethics committee, and it was called the China issue. There is a group of people called the Falun Gong, and the Falun Gong is a group who believes in certain ideas that is not accepted by other person, that it is away from normality, but it's a sort of a culture which is adopted by so many people. It's a spiritual, cultural beliefs, and the Chinese psychiatrists, they don't recognize the difference between spiritual and cultural beliefs and delusion. And that's why they were misdiagnosed and mistreated. And the WPA was bombarded from human rights activists about these people who are either in prison or in mental hospitals. And we started to negotiate with the Chinese Psychiatric Society, and actually it was a very fruitful discussion, and they were very helpful. Completely different from what happened about 50 years ago, when the Russian psychiatrists refused that the WPA meets them to investigate about the admission of patients who have political differences with the country, and they were admitted to mental hospitals. And this was the origin of the first code of ethics, which we call the Honolulu Declaration. This is the first code of ethics of WPA, which was on 1973. Going back to the China issue, we managed to get in touch with the Chinese Psychiatric Society, and I remember going there 2 or 3 times to China, and we managed to make them agree to give some education about the difference between cultural beliefs and schizophrenia or mental illness. And we managed to already lecturing about ethics, about diagnosis, about education, and so on. So we trained the trainers. Then the Chinese people started to go into the countryside in China, and it was a very fruitful endeavor that WPA had. Another thing also that we had, you remember the tsunami, what happened in Southeast Asia, when a lot of people drowned, a lot of people, houses smashed by everything. And we heard from so many people that there is one place which is called Ashti in Sumatra, in Indonesia, that these 400 children, they lost their parents. And we're very concerned about this. And we agreed with the WHO that we send some people to help regarding the post-traumatic stress disorder. But we were very surprised that after they returned, they said, we didn't find any PTSD. all these children, when we went, they were adopted by other people in the island. At the same time, they thought that this is the wrath of God, that they were not practicing their beliefs. They are very religious people, and they thought that it's the wrath of God, and they started having more faith and more belief in God, and so on. And nothing happened. So it came out that PTSD, the origin of it, it looked after only the injuries of soldiers of the United States when they started to write just anxiety and grief and irritability and so on. But it was linked as a mental illness. But this was a very good lesson to us, that not everybody, not every country have the PTSD with the same level of occurrence. And it's a collection of other symptoms for anxiety and depression. And this is the second thing that we have done. The other thing is the ethical code, but I'll speak about this later. So the other problem I faced when I was a president, that the United Nations Convention, in their convention about disabilities, they considered psychiatric illness is a disability. And disability has full rights. That's to say, you cannot impose any treatment on a patient with disability. He has full human rights. You can't admit him involuntary. You can't give him any treatment. And this is, again, was a great problem for us, because the Mental Health Act in any country, they have a provision in which there is an involuntary admission, compulsory admission. Otherwise, if the patient is refusing treatment, if he's a danger to himself and to others, and if we leave him, the condition may deteriorate. In this case, you can admit him voluntarily, either by a judicial system, or by police, or by the family, or by doctors, but they should satisfy certain criteria for the human rights. They said, no, they have a disability, and you can't treat this with disability. But all the people all over the world don't abide to this. And it was a bit changes and so on, and a lot of discussions with the responsible people of the United Nations. And up till now, we haven't reached the conclusion that some patients needs involuntary admission. It's a very important topic that I like to raise it to you.
It is fascinating to hear that despite the diversity that exists in different countries, international organizations had come so close together to work with each other so that the mental health care for our patients can be delivered with utmost integrity and sincerity.
No, I just wanted to mention that in my presidency also, we continued a very important program for the WPA, which is fighting stigma because of schizophrenia. This has been going for 10 years, and it has been, well, in many parts of the world we have done this. But what is important, that even the word schizophrenia was changing, because actually schizophrenia is not split personality. For instance, in Japan, Dr. Sato changed the name of schizophrenia to integration disorder. And this has reduced the stigma, and patients, so many of them came for treatments. And actually, the Jean Delay Prize, which is the highest, the Nobel Prize of the World Psychiatric Association, was given to Sato for fighting stigma by changing even the name of these things. Another thing I have done, and it was published in World Psychiatry, which is the official journal of the World Psychiatric Association. I sent a letter that the electroconvulsant therapy it is not convulsant anymore. Patients are taking muscle relaxants and anesthesia, and they don't have except some blinking of the eyes. So it is stigmatizing shock treatment, convulsive treatment. So it was called here brain synchronization treatment, because it has been proved that in so many patients who need this treatment, BST, they have desynchronization, and the return to synchronization comes from the BST. This has reduced stigma in this part of the world that nobody now says ECT. They say BST, and this carries a lot of human aspects, and patients who are refusing and afraid of what mass media projects about the convulsive. It's not anymore convulsive, it is just synchronization treatments. And lastly, the present program done by our President, Dr. Afzal, is very informative. What we are going to do. Apart from the fact that in last General Assembly, it was agreed to have a new code of ethics, which have 5 points principles. Beneficence: psychiatrists provide competent and compassionate medical care with devotion to the interests of the patients. Principle 2, respect for patients and autonomy. Number 3, non-maleficence. Psychiatrists avoid actions that may be injurious to their patients. Principle 4, improving standard of mental health care and psychiatric practice. And the psychiatrists recognize a responsibility to promote the continuing development of their profession and their personal professional development. And principle 5, that applying psychiatrists' expertise to the service of society. Psychiatrists, like other physicians, utilize their specialized knowledge and skills to promote mental health and well-being of persons who may be vulnerable to mental illness. Then psychiatrists in psychiatric education, ethics in psychiatric education, ethics in psychiatric research, and ethics in public mental health. And the last thing I would like to talk about is the goals of WPA for between 2020 2023, and this was presented by Dr. Afzal, current president of WPA, to promote psychiatry as a medical specialty in clinical, academic, and research areas, and to promote public mental health as a guiding principle. To highlight the specific role of psychiatrists in working with other professionals in health, public health, legal, and social aspects of care. To ensure WPA positive engagement with member societies and WPA components, mental health professionals, and general health care workers. And the action plan was public mental health, child and adolescent mental health, addressing comorbidity. This is a very important thing. The majority of mental illnesses have a sort of comorbidity with physical illness, or vice versa. Just to name it, diabetics are 4 times more vulnerable to depression, post-infarction depression, post-stroke depression, Parkinsonism depression, and so on. This has to be taken care of. Partnership with other professional organizations and NGOs, capacity building, and continuation and completion of previous action plans work. And just the last thing I would like to say, that World Psychiatry, the official journal of World Psychiatry, of the WPA, has an impact factor this month of 14.9. This impact factor has the highest impact factor among all psychiatric and social journals, has the highest impact factor among so many medical journals, and never happened in the history of psychiatry, and it is distributed freely without any advertisement to any journal or to any drug company. And I think credit goes to Professor Mario Mai, who was past president of the WPA, being the editor of this journal. We are very proud that our journal has the highest impact factor in the scientific arena at the moment. Thank you very much for allowing me to speak too much about WPA and about myself.
So your personal recollection, giving us insightful views of the history of WPA and the tremendous contributions and sacrifices that past presidents have made during their tenure, are truly enriching for us to know today. Professor Okasha, please allow me to ask you a few more questions, because the more we get an opportunity to listen from you, the more we realize the significant history of WPA and the more knowledge comes to light. Sir, how do we promote psychiatry as a medical specialty?
I think the most important thing is to have a hybrid teaching of psychiatry and medicine in the medical school. For instance, that when we present a case of thyrotoxicosis, myxedema or hypothyroidism, we present at the same time the psychiatric concomitants of these illnesses, the depression and so on. If you are presenting cancer head of pancreas, we have to present the comorbid. If we present diabetes, we have to have the comorbid psychiatric problem. In this case, because people believe sometimes that psychiatry is like psychology and that we only deal with the social and psychological problems, but not real disorders. And this is the only way that we can recruit more psychiatrists all over the world to attain that physical and mental comorbidity is very common. And it's just enough that you have 30% of the population are suffering from mental disorders. And just to give an example, that 70% of cases going to the primary care to be treated from somatic disorders, this proved to be a psychiatric problem, namely an anxiety depression. So I think this is the only way to have more recruitment. And I have done this in our medical school. The first year I used to speak about ethics. The second year, psychology. The third year, psychopathology with the pathology. The fourth year with hygiene, all the mental hygiene. And the fifth and the sixth, usually, that having the hybrid with, we start the psychiatric illness by talking about physical illness and so on. And this recruited for the first time, the first students in the final years wanted to have psychiatry instead of surgery and so on and so on. And it was very proud. After I left, of course, this has been reduced a bit again, but still we have this in our medical school.
The innovations you had in teaching the undergraduate students is fundamental, and we all across the world need to implement this. So, next question that I would like to ask you, and this leads us, is on the concept of integrating psychiatry with other medical specialties. Professor Okasha, what steps do we need to take to improve our relationships with colleagues from other specialties and, in fact, allied specialties of mental health care?
Well, it's very difficult to say, but I mean, to have a good relationship with your colleagues, to have some sort of a charisma with the policymakers of any medical school, because every specialty is fighting to have more hours for teaching the medical students. But I think the head of departments of psychiatry, or in some country it is neuropsychiatry, or human sciences and so on, I think it's very important for the leaders of psychiatrists all over the world to have a good relationship with policymakers and their colleagues so that we can grasp and fight for more hours for this hybrid teaching.
Thank you, Professor. What will be your message to the future leadership of WPA so that the organization can effectively function to rise to newer heights?
Well, as you know, the expectation of the future depends on the biological technology and the information technology. And you know now that digital psychiatry is the vogue. I just want to remind people that in psychiatry, the human relationship, this is my own feeling, is different to speak to a computer with no emotions and no consciousness. And this has a completely difficult thing, apart from the fact that so many people up till now cannot have an access to the modern technology. You have so many people all over the world who doesn't know how to read and write. So I think that using a computer is not a very easy thing for them. So we have to be careful in going so much with this technology that it may affect the relationship between the patient as a patient or as a person and the physician or the psychiatrist. I'm very afraid. Even the COVID-19 had made quite a change now in the people when they had this social and physical isolation from each other. And you can't treat everybody through internet. Some people are trying now that they treat themselves. I don't think that this can help. So there are so many benefits and so many risks for digital psychiatry. And I have to remind the people for this because we are not going to see the results before many years. Thank you very much for inviting me to speak with you.
That was Professor Okasha, who was the past president of WPA from 2002 to 2005. So we thank you from the bottom of our hearts for your time and the beautiful messages that you have given us. We wish you all the very best and pray for your good health always. Thank you.